Health Cabinet Secretary Susan Nakhumicha has told the Senate that there has been disruption of services in medical facilities due to delayed payment of NHIF claims. However, Nakhumicha has assured those following discussions with faith-based and community health facilities that it was agreed that services continued to be offered even as the ministry's transitional committee on NHIF to the new SHIF works on verifying the payment claims in order to pay them as soon as the National Treasury releases the funds. The Health CS has meanwhile tabled a list of 10 medical facilities being investigated over alleged fraudulent practices, saying the Ethics and Anti-Corruption Commission is investigating them with a view to take action, including suspending any facilities engaging in the malpractice.
Honorable Speaker and members, the issue of medical insurance fraud committed by health facilities in Kenya, including the private sector, is indeed a serious concern that has received attention from the Ministry of Health, regulatory authorities, and enforcement agencies. There have been reported cases of facilities engaging in fraudulent practices to unfairly generate revenue, such as impersonations, raising fake claims for patients who never received any service, ordering unnecessary tests or procedures, providing incorrect diagnosis, and inflating bills submitted to insurance providers. These fraudulent activities not only harm patients by subjecting them to unnecessary medical interventions, but also lead to financial losses for insurance companies and undermine the integrity of the healthcare system. Consequently, the Ministry of Health, the National Health Insurance Fund, and the Kenya Medical Practitioner and Dentist Council have taken action to address these issues, including suspending facilities found guilty of engaging in fraudulent practices. Currently, the prevalence of medical fraud as per external actuarial analysis stands at 20%. It is important for stakeholders, including insurance providers, regulatory bodies, investigative bodies, and law enforcement agencies to collaborate in identifying investigating bodies and law enforcement agencies to collaborate and identify investigating and prosecuting individuals and facilities involved in insurance fraud. By enforcing strict regulations, conducting thorough audits, and promoting transparency and accountability in healthcare delivery, we can collectively work towards combating fraudulent activities and safeguarding the interests of patients and insurance beneficiaries. I want to confirm that the ministry is seized of the figures. The total money owed to NHIF is 30 billion. And out of this 30 billion, Senator, 22 billion is from government institutions. And that is why I stand here confidently saying that, having had the discussion chaired by His Excellency the President, the Ministry of Treasury, and Ministry of Health, there is a plan for release of resources, which I have confirmed that we are going to receive this week. The PS actually got confirmation yesterday of the 8.5 billion. And this money is going to be put to prudent use of payment of claims.